So what are the important measures in lifestyle optimization so that we can reduce the risk factor of carotid artery disease, peripheral artery disease, and venous disease equally?
So again, it's a very interesting question because all these diseases, the knowledge is there just to prevent this disease. Now, there are two ways you can prevent. One is to adopt a very healthy lifestyle. And the second thing is, suppose you're born with some high risk factors. What is that which you can do to actually prevent this? So let me come to the first lifestyle modification, which is in general for everybody to maintain your vascular health. In that way, you can prevent heart attacks, you can prevent strokes, you can prevent, your kidney damage and leg attacks and amputation and your life, which will, you can prevent deaths. Now, the first thing is that you need to eat right. And what I mean by eating right is that your diet has to be at a proper time. It has to be low in carbohydrates, it has to be low in fats, and it has to be very rich in fruits and fresh fruits and vegetables. So that's very important because there has been a big study, the Interheart study, which has actually addressed these issues and found these are very important risk factors, especially in our country. Then what is important is you have to be active. There's no space of scope of sedentary life now. And you must walk at least 40 minutes a day. You must not be sitting more than 40 minutes in one stretch. And especially if you are above 40, you must take, adequate dietary precaution, exercise, and a test, the baseline test for your, to know where you stand in terms of risk factors. The third thing is sleep. You have to sleep at least 6 hours, and that sleep has to be sound. Many people would sleep for 6 hours or 8 hours or 10 hours, but their sleep is interrupted and they are snoring in between. And that we call as a sleep apnea syndrome. Or they become, devoid of oxygen, and they have to get up in the evening, in between the sleep in the night, and they sleep over the daytime. So these people have obstructive sleep apnea, and this becomes a very important risk factor for strokes and peripheral vascular disease and heart attacks. So the sleep quality is very important, and the sleep duration is very important. The fourth is exercise. Exercise is very important in the sense after you must start it as early as possible. 40 minutes of exercise a day, at least 5 days a week, is important. And the exercise, the way you have to do your exercise is that you have to increase your heart rate. Those gymmings with weightlifting is only going to make your muscles. It will probably stress you more than what it is good for. You may have more heart attacks and more strokes if you are doing only those. What is good, the type of exercise is an aerobic exercise where you have to increase your heart rate, and the heart rate should be increasing to your target heart rate, which is 220 minus your age. So that means if you are, say, 60 years old, so your heart rate should be 160. That is your target heart rate. 220 minus 60 is 160. And 85% of that is the heart rate which you must achieve doing any exercise. It could be walking, swimming, or treadmill, or whatever you want to do. And this should be done regularly, 5 days a week, 40 minutes at one time, and at a regular interval. That exercise is good for your cardiovascular health. And then, of course, if you have risk factors like hypertension, diabetes, blood pressure, you need to control them, not only with lifestyle modification by modifying your diet in terms of salt and carbohydrate intake, but you must also, and fat intake, but you must also take drugs. Now we have very good drugs which can actually prevent, and reverse actually the, heart disease, carotid disease, as well as diabetes and related damages because of diabetes. So these are the various, lifestyle modifications which you have to do. And one more thing in the end, which is very important, is to de-stress yourself. And de-stressing actually works in many ways. It not only reduces your blood pressure and diabetes, but it also increases a lot of antioxidants and good hormones in the body, which positively affect your vascular health. So they are very important. And of course, you don't have to smoke. That goes without saying. You don't have to smoke. You don't have to take party outside. You don't have to take oral contraceptive pills. So all those alcohol, those things are to be avoided. And now during the COVID time, the very important studies have been done because all over the world it's been seen probably the number of heart attacks have gone down. If not gone down, at least less are coming to the hospitals now all over the world. And what they found, the two important risk factors, apart from many other risk factors, which have been reduced, are eating out and good quality of air. That means pollution all over the world. These two were supposed to be very important risk factors. And now once they are suddenly gone, we can see the implications of this. And again, this affects the vascular health and acute vascular problems. So these are very important. So this binging of food or alcohol, eating out, and living in a very polluted atmosphere is again to be avoided if you want to prevent these sort of diseases.
It's very important. Dr. Khanna ने कहा, most important thing is regular exercise. If you don't exercise, you're prone to get carotid artery disease, peripheral venous disease, and peripheral arterial disease. अब वो exercise कुछ भी हो, walking, swimming, dancing, cycling, treadmilling, exercise is a must. Minimum half an hour every day. Dr. Khanna is very, very categoric. He says exercise रोज करना है. जैसे अब खाना रोज खाते हैं, वैसे exercise भी रोज करना है. Dr. Khanna is also told one very important thing. He said, जैसे हम रेगुलर खाना खाते हैं, वैसे ही रेगुलर एक्सरसाइज करना है और वैसे ही हमें इनफ क्वांटिटी पानी पीना है. हाइड्रेशन इज द नीड ऑफ द आवर. अगर डिहाइड्रेशन होगा तो हमारी धमनियों में खून के थक्के जम जाएंगे, चाहे वो वेन हो चाहे वो आर्टरी हो, तो वो बचाना है. तो कम से कम 1.5-2 लीटर पानी जरूर चाहिए हमारे अंदर. उन्होंने एक चीज और भी बताई कि कोई कंट्रोवर्सी नहीं है आज की डेट में कि विटामिन मत लो. क्या कंट्रोवर्सी क्या है? अगर बॉडी में ऑक्सीडेटिव स्ट्रेस को कम करना है तो हमें नियासिन लेना है, हमें विटामिन ए लेना है, विटामिन सी लेना है, विटामिन डी लेना है, विटामिन ई लेना है, तो सारे विटामिन लेना है. उन्होंने एक चीज और भी कही कि बॉडी में ओमेगा 3 फैटी एसिड की कमी नहीं होना चाहिए. अगर ओमेगा 3 फैटी एसिड डेफिशिएंसी हो गई तो हमारी बॉडी में इन्फ्लेमेशन हो जाता है. इंडिया इज द वर्ल्ड कैपिटल ऑफ ओमेगा 3 फैटी एसिड डेफिशिएंसी. उसके कारण नाड़ियां या जो धमनियां हैं उसमें सूजन आ जाती है.
If you find a block in the carotid artery, what you do is you put these patients, if there is a clot there in the brain and the carotid arteries, you treat them with a thrombolytic drug or fibrinolytic drug, or in general words you can say it's a clot buster drug. It's the same drug which we used for heart attack or lung attack or leg attack, where what it does, it dissolves the clot immediately.